No problem.
Okay. Hi, Chris. How are you?
Yeah,
I'm
sorry.
just
For the
starting
first-
our recording here.
No problem. No
All right.
problem.
So you had a question like, what are you supposed to put in each section, and what does it mean?
Right.
Application of theory or application of your framework, excuse me, to your paper. So let's pull up the rubric here, and we can walk through a little bit of this. So those sections pretty clear. Then we get to,
Yeah. So like, right. So like down in the methods, so that's what basically I turned in as far as my framework.
mhm.
And then if you go to number 3, application of framework to your proposed intervention, and then go below it.
Yeah, this application of framework. Okay,
Yeah.
so
Yeah, like professional
we're,
organization and
all
stuff.
right, so we're in methods, and I would think I would just say methods is, so how are you, the methods for you to roll out your proposed intervention. That's what it's, the methods section is. So how are you going to do this proposed intervention?
So I had a question. So we don't so basically well, from my understanding is we introduced the the framework or the conceptual framework we think that aligns with our proposed intervention.
Mm-hmm.
Then after we explain, like my my framework was a Kolkaba's theory of comfort. I
Mm-hmm.
explained the the details behind it. And then is part C, is that when you introduced your actual proposed intervention, if I'm not mistaken?
You could have like a little
Because I
paragraph,
have a
right?
proposed intervention in mind.
Um, you know,
Pardon?
everybody's paper, I think, is a little bit different. And maybe all of these things, don't make sense in this order. But really,
Yeah.
this is the section where you're going to say why you're doing what you're doing, your proposed intervention. And your proposed intervention isn't a research study. It's like something you were going to do to change practice or
Yeah.
bring to practice. And for you, it would be virtual reality, bringing that to practice. So
Right.
you could have a little intro section here that says, in this section, I will describe the evidence for a proposed intervention. No, you already had. I will describe the intervention I would like to propose, and you could say evidence to back up this intervention. So that's really what this supportive evidence is. So you want to have, you have virtual reality for pain reduction. So you went to the review of the literature and you found evidence to say, yeah, that it works. Now you're going to a theory to say that, yes, if you do this, then X will happen. So your theory, Kolkaba's theory, says if you reduce pain, there'll be better outcomes or something like that.
Yeah, ideally, yeah.
Right. So then, that's a theory that's supporting what you're going to do. So you describe the theory here. You tell if this theory's been used in maybe for pain relief before. Probably hasn't been used in virtual reality, but if you found something really specific and related to virtual reality, that would be great to say in this paragraph or two. This theory has been used in pain reduction before.
Okay. I guess what I did is just looking through the review of literature. I mean, based on what I learned about the theory of comfort theory and stuff like that, then I kind of analyzed it where it kind of was applied through the review of literature. You know what I'm saying, based on my analysis, and that's what I put in my my paragraph. It kind of ties in with that theory.
So say that again.
So basically, um, what I did was based on the review of literature, and I kind of analyzed it based from my review of literature, how Kolkaba's theory tied into the previous literature I found about virtual reality, like my analysis of it, and that's how that was my understanding of previous application of framework.
Okay. All
Is that
right. So
does that work too?
um, that might be more about the application of the framework to your proposed intervention. So that might be better for this section here, um, for the application section, because this is looking at previous work done by other people.
Okay. So then, so for number 2, then what would I, because, virtual reality, I don't know if there's necessarily, um, so how would I tie that in? Would it
You
just,
could look for any studies, or you might have already seen something that might have used Kolkaba's theory for pain reduction. Just say, see if you can find anything that use Kolkaba for any kind of intervention related to pain relief, maybe cancer comfort, palliative care.
oh, okay. Not necessarily to my, oh, I got it. So not necessarily to my, like, my research
Not to
about
your
KR.
specific intervention, yeah.
Oh, okay. As long as it was, okay. Okay. I got it. And then I guess, yeah, what I got, what I was kind of thrown off by, like, I don't know if I did it right too, was under application of framework to your proposed intervention, like, professional organization, like this stuff, yeah, right here, the subheadings of number 3.
So
Like, what?
we're still in supportive evidence for the intervention. So professional organizations, clinical guidelines,
Right.
this is where you
So I
might want
found,
to. Go ahead.
hello, can you hear
I
me?
said, yes, go. Do you found something for
Oh,
that
no.
section?
Well, I kind of looked at, like, the International Association of, for Pain Studies, like that was a professional organization. And then I just kind of looked at, like, how they, how it ties into my proposed intervention, I guess.
That sounds right.
Okay. Okay. And then, yeah, I think that's it. I don't know what else.
Yeah,
Number
and like
six.
right
Go ahead.
here, like results of the review of the literature could just be like, one sentence. The review of the literature showed that virtual reality could be effective for distraction, right? That's what you
Mhm.
found. And then you would say, and then if there's anything to pull in from the related issues section, you know, e-health or technology is being used more and more and more, accepted more, reimbursed more. So those are all, showing reasons why you would, this intervention should be carried out, your proposed intervention.
Okay.
Because a theory supports it, because professional organizations support it. What you had in the review of the literature section said it was good, and related issues also said it was good. So this really could be a small part from this 2, 3, and 4 that refers the reader back to why you're doing what you're doing. So you've already done all this work, right? In your paper, you've already talked about what professional organizations, the current status of management. You've already discussed the whole review of the literature, related issues. So you're just referring back maybe 1 or 2 sentences that say, this is why I'm doing this.
Okay. And then C, this is the actual, like, how I'm gonna set up my proposed intervention, like based on setting and all that stuff.
Exactly.
Right?
Yep. How you're gonna roll it out.
Okay. And then I'm just curious though, like with the my theory of comfort, because you know, like a lot of the theories are like in diagrams and stuff like that that labels each variable. Do you want us to do that in that same context too?
You can. I mean, a lot of people will use a framework to organize their writing and kind of say, you know, like, I'm not sure what the sections of Kolkhaba's theory are, but say, for example, use a different theory like the health belief model, and then it has all these, you know, perceived benefits, perceived barriers. So you could write out your intervention saying how your intervention is addressing each one of those, but you don't really have to. I mean, you already did due diligence here, showing that your intervention, your virtual reality, is going to, you know, be reduce pain, increase comfort, and Kolkhaba says that's, you know, part of man's holistic need, right?
Right, right. Yeah, because it's all right, right.
You don't have to.
Okay, gotcha. And then if we go up, sorry, to the methods section again
Yep.
on the first part.
Mm-hmm.
So like are you up there? Yeah, yeah, right there. Let me see. Oh yeah, because I remember like on my previous paper I sent you, it said you said like why did you put the role of the MSN or APRN, and I put a section about that, and then you asked about like what does professional organizations say about it. Oh sorry,
Mm-hmm.
you know number 5 before where it says specific to the context of the healthcare topic in your MSN, that one.
Yeah.
Yeah, you asked me to put that. And then, but when I went down there, when you go to methods in 5A, isn't that the same thing? So that's why I sent you what you
Well,
call it, that section that talks about the NP
so
scope
if
and
you're talking about, you
standards. Is
know,
that
an
right?
NP, how are they gonna reduce pain in with you know, in adults or something like that? So the NP's role is really to assess, diagnose, treat, right? But somebody might be writing this paper
Right.
who's in a nursing education master's or a healthcare administration and leadership master's. So they're going to say, how do we reduce pain? Well, what do we have for resources for people at our hospital to reduce pain? How are we looking at this from the clinic? How much staff do we have? What assessment tools? Is our EHR, you know, able to record pain, you know, and things like that. So that's kind of what number 5 means in the related issues section.
Okay.
So it would be more related to that, and if you haven't already addressed it in your review of the literature. So if you know, if you've already done this somewhere else in your paper, then you don't have to really put it in there.
Sorry, you cut it off. What would you say
Oh,
again?
so I said if you've already done this in parts of your paper, you wouldn't have to do it elsewhere.
Oh, okay then. Yeah, I guess because what confuses me sometimes, like I would see, because yeah, like I'm trying to obviously organize my paper section by section by section, so I'm making sure I'm grabbing all the points. I'm talking about all my points specific to the rubric, and then
Yeah,
I just feel like sometimes it's kind of repetitive.
it can be repetitive, but you know, we just want to make sure that it's covered, and everybody's a little different. So
Okay.
if somebody's talking about, you know, nursing education for somebody who has diabetes, well, you know, you need to make sure you're considering, you know, the context they have diabetes in. You know, are they able to, you know, what's their health literacy, and
Yeah.
are they able to, you know, pick up a pamphlet and read the medical, you know, jargon that's on there? Can they not? So
I see.
everybody has a different slant the way they're writing this paper, so it's hard to have one rubric, you know, to rule them all. But it
Oh,
can be repetitive. And I think even
okay.
up in the beginning, right, there was something about your MSN role here. So this
Sorry. You're cutting off again. Sorry. What'd you say?
Let me put this on my hotspot. Hold on. Because I notice it does keep cutting out.
Yeah.
So here, you see this part here,
Yeah.
the MSN role specific to your program. So it's there again. So it's really there 3 times.
Right. This kind of throws me off. And then I guess that's why you know, like, I know you were questioning, well, why did you put the role of your APRN blah blah here? You know, you should, you know, put it somewhere else. And I'm like, the reason why is because I was just basically going down the rubric one by one, and then like, you know, but like you said, I guess if I covered it, then I don't have to repeat myself.
Yep.
Right.
And this really should be, you know, under impetus. Hopefully we won't get cut off anymore. This is the MSN role specific to your program. So as a nurse practitioner, I deal with these patients a lot. As a healthcare administrator, you know, I have to interact with overworked nurses. As a nurse educator, I'm responsible providing the curriculum so nurses have the competencies to care for people with this. So that's really what the MSN role is in this section. In the next section, related issues, this is really, so as a healthcare administrator, what are the, you know, reimbursement issues? What are resources do I need? What kind of staff might I need for this? As a nurse educator, you know, what are we already teaching nurses? What might be a gap in about what we're teaching them? What about using simulation, stuff like that? As a nurse practitioner, you know, you want to really consider a person as a holistic person and make sure that you are looking at this section this person from all angles in this section.
Right. Yeah, which I think I did. I mean, I tried to.
Yeah,
You know,
I think you did too. It's just confusing there. And then for the methods section, you want to have an intervention that you would do as a nurse practitioner. And a healthcare administrator would want to have an intervention that they might do in their future role as a healthcare administrator. And same as a CNS and a nurse educator.
So, so just curious. So within methods and the scope and practice standards, that's what I wrote down is that's when I discuss, like, you know, kind of the standards of practice of an NP from the American Association of Nurse Practitioners. Is that right?
Yep.
Kind of listing it. That's right.
Yep.
Okay. Cool.
And you know, CCNE talks about, and even our APU nursing program learning objectives, you know, also talk about what the competencies are that you should have as a nurse practitioner. And so these would be things like you would want to make sure that you assessed pain carefully, that you knew the current strategies for treating pain, you know, that, so things like that.
Okay.
That's what can be in the scope and practice standard. And that the approach aligns with the professional role. That's what we already talked about.
All right, cool. I think I got it. I just have to reorganize stuff. And then I know nothing's due this weekend, but I guess I didn't realize it was spring break. But I know I'm just so caught up with this paper. I just, you know,
You're almost done.
Yeah, I guess. But for next week though, is that when you want the section about the proposed intervention to be sent as a draft if you want?
I think so. I'll have to, let's look.
Okay.
And have you gone to the writing center yet?
I have mine scheduled for Monday. I couldn't go last week because I've been sick the entire week. I didn't
Ah,
go to the
yeah,
doctor.
just, did I tell you this already, that when you go, make sure you have a specific list of things to address with them? Like your writing is pretty good, so I would say, maybe just ask them, say, will you look at all my headings and make sure that they're right? And will you look at my references? So you
Oh
could
yeah,
have a whole, one visit with them just to go over your references, and then like
oh yeah.
say, okay, that's enough. Because sometimes if you give them too much, it just kind of blows their mind.
Oh yeah. I actually they when you put it online, they ask you what do you want to work on, and then
Oh,
I put
good,
APA formatting and grammar.
good.
Uh, so they should be able to kind of have a heads up already on
Yeah.
what to expect. Yeah.
So you don't
And
have anything due this Sunday. The next thing that's due is the Master's Prepared Nursing Role. So that's due on the 15th. And then the solution intervention is due the 22nd. But
okay.
if you want to just get this stupid paper done with and get it a final draft to me earlier, that's fine.
Okay.
You can just keep going. These are just dates that I want, uh, you know, um, want you to have this to me, because if I don't get it from you by those dates, it's
Right.
going to be really hard for me to give you the right feedback so that
Right.
you can, then
Yeah.
go on to work on the next section. But
Right. Fine
you
tune
are
that.
already are up to here.
Uh-huh.
And then outcomes is a small section. Implications, these sections are pretty small here.
Okay.
Um, and the implications for practice and conclusion is where you'd say, okay, my paper's done. Now I can write my abstract that reflects on what my paper's about. Now I can write, maybe an introduction should change a little bit, so you can go back over those kind of things.
Okay. Sounds good.
And then just because we are recording this, I just want it, if other people are watching, this right here, this final paper is where you're gonna submit it, and then that will go through VeriCite, which is our plagiarism detector, and
Right.
then
Right.
it'll give you a similarity score. So at that point, you can say, oh, I think I need to go back and uh, paraphrase this a little bit better because it's showing up. So
Okay.
this, I think, is really nice to have this built in, because it's so easy sometimes to cut and paste from an article and say, oh, I'll go back and fix that later, and then you
Mhm.
just forget. So
Yeah.
you can really do that anytime you're ready with your final
Okay.
draft.
Sounds good. Sounds good. Hello.
Okay. Hold on one
Hello.
second. Hold on one second. I'm going to stop the recording.